Hi guys, good afternoon and happy new month. Happy Sunday. My name's Atisha Chizaram and I'm a medical laboratory scientist. And on this space, I'll be bringing you vital health informations that are not just random hearsays, but things that are backed up by facts, research, science, and by virtue of practice, my practice as a medical laboratory scientist. Now, today I'll be talking about infections. There are several types of infections: bacterial infections, viral infections, parasitic infections, and fungal infections. Viral infections are caused by viruses, your hepatitis, your HIV. Fungal infections are caused by fungal organisms, and parasitic infections are caused by parasites like your malaria and filariasis. Now, talking about bacterial infections, they are caused by bacterial microorganisms, and there are several types of microorganisms. Even in the body has microorganisms that are just there. They are called normal floras. They can be found in the nose, in the mouth, in the guts. That's your digestive tract. Now, all they do is just carry out normal biological processes and functions. Basically, when they begin to multiply excessively, or a particular organism that should not be in a particular place, finds its way to that site, it begins to, multiply and cause infections. The common types of infections we have are your urinary tract infections. For urinary tract infections, how do you know you have an infection? Burning sensation while urinating, a strong and persistent urge to urinate, but when you get to the bathroom, you just be um, voiding just little amounts of urine, but you're still feeling pressed. Cloudy urine, foul smelling urine. You also have genital odor, and then this deeply colored urine. The normal color of urine should be amber and clear. Also, you can have normal symptoms like headache, fever, pelvic pain, back pain. So these are some of the symptoms that will show that you may be having an infection. When it comes to urinary tract infections, there's this common notion that they are gotten from toilet seats. But I want to debunk that because some of these microorganisms can survive outside the body or on surfaces for long. They die off. They need a host, moist areas for them to attach and grow and begin to multiply. Now, what are the causes of some of these infections? I'll be listing some things for you. One of the major causes could be wiping from back to front after using the toilet. After passing stool, you wipe from back to front. There's this organism that is a normal flora of the gut, the digestive tract. It's called the E. coli and is indicated as a causative organism of urinary tract infections. Now, when you pass through, there are chances that you must have passed some of these microorganisms as a normal flora of the digestive tract. Now, when you wipe from back to front, you're introducing this microorganism to your urethral area, and it gets access, moves up to the bladder, starts causing you urinary tract infections. Another way is the body has a way of washing off microorganisms when you urinate. Now, if you're someone that you like to hold your urine, you're only giving your body room to multiply bacteria that are around your bladder and urethra. So always urinate frequently. It helps to wash off microorganisms. Also, keep your genital area clean and dry. Don't wear jean from Monday to Friday. There's no air entering there, and you're only giving that place a room to harbor microorganisms. Sometimes wear free clothes, wear things that will allow air and allow that place to be a little bit dry. Also, wear clean underwear. It's very important, very, very important. And as women, we are tempted to use scented soaps, feminine hygiene products that has certain flavors. All those things are not necessary. If you keep using them, you're going to be washing off the normal flora that should be there and maintain a balance. Microorganisms love sugar a lot. So if you're the type that likes junk, avoid excessive consumption of junk foods, sugary things, alcohol also weaken the immune system. When your immune system is weak, there are white blood cells that specialize in fighting infections. And when your immune system is weak, these white blood cells cannot do their job effectively to fight off infections. And then also sexual activity, fingering, oral sex, these things predispose us to infections. Now, some persons have recurrent infections. Almost every month you're treating infections. It could be one, your lifestyle, your sexual lifestyle, your partner. It could be two, your hygiene habits. Yeah. When you wash your innerwear, put it out to dry for air, for sun to, bleach it. It's a way of, sterilization. Another thing is because you have refused to actually come to the lab and take a test. You're just taking antibiotics blindly. That is number one. Because when you come to the lab and you are tested, we do what we call antimicrobial susceptibility or sensitivity. We take antibiotics, drugs, known antibiotics, and dosage, and test them against the organism to see if it will clear it or not. So we'll tell you the particular medication you should take, and you won't have to take anything, abuse antibiotics. Now, some of you again, the thing is, your body has developed antimicrobial resistance. You have taken so much antibiotics such that anyone you take, it will not work again. Anyone you take, it will not work again. That's why you're having recurrent infections and you have refused to treat it properly. With that being said, I know you have questions, comments, and things you want to, ask, probably get clarification on. So, like, follow, share this to someone you know, and it will help someone, it will educate somebody. And if you have any question or questions or something you want me to talk about or treat, because your reviews would help me know your pain points and know what to talk about and address and help you better. So if you have any comment, review, question, please drop them in the comment section or send it to my DM. I would answer it, likely make a video on it, and every other person will get to learn from it. So thank you for watching. Thank you for following this space. Thank you for looking at my beautiful face. Thank you guys. So see you next time.